Good morning to all of you, to Gisela and to everyone following us in different parts of Cuba and abroad. Today, we're going to give you the latest information on the COVID-19 situation in Cuba, which is favorable. Today, 249 patients continue to be hospitalized, 14 under observation. There are 164 suspected cases and 71 confirmed active cases. In our primary healthcare system, 233 people continue to be monitored by our healthcare professionals and specialists. Yesterday, 2,978 samples were processed in Cuba's various molecular biology laboratories. 1,417 in the Pedro Curi Tropical Medical Institute, 432 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, in Havana's 376, 284 in Santiago de Cuba's, 353 in the Hermanos and Mujeres Hospital Laboratory, 79 in the Genetic Engineering and Biotechnology Center Lab, and 37 in the Civil Defense Laboratories. Of the 2,978 samples processed yesterday, 2 tested positive. With the samples processed yesterday, this brings the total number of samples processed to 208,098, 2,428 of which tested positive for SARS-CoV-2 and COVID-19. This represents 1.2% of all samples processed. Yesterday, samples were studied from all of the country's provinces, the largest number in Havana, as is to be expected, in order to detect, identify, admit and isolate cases and trace their contacts. In Havana, 2,377 were processed, 171 in Pinar del Rio, 173 in Matanzas, 120 in Santiago de Cuba, 70 in Holguín, and in this way we continue to monitor at-risk groups in the country. The 2 cases confirmed yesterday, as we have seen previously, are both Cubans. One is a contact from a previously confirmed case, meaning that 2,107 confirmed cases, or 88.3% of all cases in the country, have tested positive as confirmed case contacts. One of the 2 cases confirmed yesterday contracted the virus abroad. The patient is a Cuban who lives abroad and recently returned to the island. He was put into isolation in the province of Villa Clara because that is where he's from. He was tested and the sample came back positive for SARS-CoV-2 and COVID-19. This case brings the total number of people who contracted the virus abroad to 168, or 7% of all confirmed cases in Cuba. The number of cases where the source could not be determined remains at 111, or 4.7% of all confirmed cases. Of the 2 confirmed cases yesterday, one was male and the other female. Of all diagnosed cases in Cuba, 49.6% are female and 50.4% are male, a similar rate between both sexes. Both cases were asymptomatic, an important and complicated characteristic of this illness. This takes the total number of asymptomatic cases at the moment of testing in Cuba since the pandemic began to 1,328, or 54.7% of all confirmed cases. If we analyze this indicator, over the last 15 days, the rate has increased to 72.5%, and every day I give this information to raise awareness of the importance of increasing testing, above all in the provinces, among at-risk groups or where transmission has occurred, in order to identify all people at risk, people who have been in contact with confirmed cases, diagnose them, admit them to hospital, isolate them, and study everyone that they have come into contact with. The 2 individuals diagnosed yesterday are both over 60 years of age. No children tested positive yesterday, but anyway, in Cuba, 276 patients under the age of 20 have tested positive for the virus. Of these, 94.2%, or 260, have been discharged after making a full recovery and have generally not been severely affected by the illness. Of the 2 cases diagnosed yesterday, one relates to Havana and is the result of local transmission in the municipality of El Cerro. The other is from Villa Clara, but doesn't affect the province's COVID-19 statistics as the individual contracted the virus abroad. That is to say, infection didn't occur through local transmission. In addition, according to protocol in Cuba, the individual was transferred directly from the airport to an isolation center. They had no contact with people from Villa Clara or elsewhere in Cuba, except those that were also traveling on the same airplane. Given the 2 cases confirmed yesterday, Havana continues to be the province with the highest number of confirmed cases, although there were fewer confirmed cases today, for a rate of 4.07. I'm talking about the rate of confirmed cases per 100,000 inhabitants. Lower, I stress, than yesterday's rate. Mayabeki has a rate of 0.78 cases and therefore continues to place second. Cuba in general has a rate of 0.86 per 100,000 inhabitants, lower than the rate yesterday. As such, to date, there have been 2,428 confirmed cases. 71 continue to be hospitalized, or 2.9%. Of these, 70 are in a stable condition. This is a positive indicator which reflects the effective care and treatment patients are receiving, and often the treatments applied before testing. Regrettably, 87 people have died thus far in Cuba as a result of the virus, and we send our condolences to their families. However, there were no fatalities yesterday. As such, the COVID-19 mortality rate in Cuba stands at 3.58%, which compared with the regional rate of 4.28%, places the island in 21st position among countries with COVID-19 cases in the Americas. Given its mortality to confirmed case rate ratio, Cuba continues to hold 104th position in the world. As always, we mentioned the 2 confirmed cases that were evacuated at the beginning of the pandemic. Yesterday, we saw another positive indicator. 10 patients were discharged from hospital, all in the province of Havana, bringing the total number of people to have recovered from the virus to 2,268, or 93.5% of all confirmed cases on the island. There continues to be 1 serious case corresponding to a patient in the Salvador Allende Hospital in Havana. And for the 17th day in a row, there have been no critical patients to report in Cuba. As we have been seeing in the news and on the television around the world, an effective response to the virus has still not been achieved. In the world, the virus continues to be present in the same 185 countries. The number of confirmed cases worldwide currently stands at 12,698,995 and is rising, given that 222,967 cases were diagnosed yesterday. And more importantly, 4,926 people died yesterday as a result of the virus, for a mortality rate of 4.45%. There are currently 6,585,097 confirmed cases in the Americas, representing 52.64% of all confirmed cases worldwide. This after 135,537 of the 222,967 cases confirmed yesterday came from our region. 3,103 people died in the region yesterday of COVID-19, for a total of 286,796 fatalities and a mortality rate of 4.29%, as previously mentioned. Of the 4,926 deaths yesterday, 3,103 occurred in the Americas. This is why we've been seeing that the region of the Americas has become the epicenter of the pandemic over recent weeks. The largest number of cases come from this region. The United States continues to top the list of countries with the highest case rate, with 3,247,684. Yesterday, it reported 63,051 cases and 717 fatalities, for a total of 134,8 814 deaths. Brazil follows with 1,839,950 confirmed cases, 39,023 yesterday, and a total of 71,400 deaths. 1,071 fatalities occurred in Brazil yesterday. Next on the list is India, then Russia, Peru, Chile, and Mexico in order of confirmed cases. This is the information we have on the behavior of the pandemic in Cuba and across the world.